The lungs are a pair of spongy organs in your chest that form the center of your respiratory system, responsible for exchanging gases between the air and your blood. When you inhale, oxygen enters your lungs, travels through tiny air sacs called alveoli, and transfers to the blood. Simultaneously, carbon dioxide, a waste product, moves from your blood into the alveoli and is exhaled. The diaphragm, a muscle below the lungs, drives the breathing process by contracting and expanding your chest cavity. Key functions: gas exchange. Lungs take in oxygen, which is vital for all your body's cells, and remove carbon dioxide, a waste gas. Respiration. They enable the intake of air through inhalation and the expulsion of air, a process controlled by your brain and the diaphragm. Vocalization. Lungs provide the airflow necessary for your voice and speech. Anatomy. Location. The lungs are located in the chest cavity, thorax, on either side of the heart. Lobes. The right lung is divided into 3 lobes, upper, middle, and lower, while the left lung has 2 lobes, upper and lower, to accommodate the heart. Alveoli. Millions of tiny thin-walled sacs called alveoli are located at the ends of the bronchioles, and they are the primary sites for gas exchange. Pleura. Each lung is encased in a thin membrane called the pleura. How lungs work. 1. Inhalation. When you breathe in, the diaphragm contracts and moves down, while chest muscles expand the ribcage, drawing air into the lungs. 2. Gas exchange. The air travels through the trachea and bronchi to the alveoli. Oxygen moves from the alveoli into the blood vessels, capillaries, surrounding them, while carbon dioxide moves from the blood into the alveoli. 3. Exhalation. The diaphragm relaxes and the chest cavity returns to its resting position, pushing air, now rich in carbon dioxide, out of the lungs. Lung cancer is a type of cancer that starts when abnormal cells grow in an uncontrolled way in the lungs. It is a serious health issue that can cause severe harm and death. Tobacco smoke is the leading cause of lung cancer. Symptoms of lung cancer include a cough that does not go away, chest pain, and shortness of breath. It is important to seek medical care early to avoid serious health effects. Treatments depend on the person's medical history and the stage of the disease. The most common types of lung cancer are non-small cell carcinoma, NSCLC, and small cell carcinoma, SCLC. NSCLC is more common and grows slowly, while SCLC is less common but often grows quickly. Lung cancer can cause several symptoms that may indicate a problem in the lungs. The most common symptoms include cough that does not go away, chest pain, shortness of breath, coughing up blood, hemoptysis, fatigue, weight loss with no known cause, lung infections that keep coming back. Early symptoms may be mild or dismissed as common respiratory issues, leading to delayed diagnosis. To prevent lung cancer, the most crucial step is to avoid tobacco smoke, either by not starting to smoke or by quitting if you do, and by avoiding secondhand smoke. You should also test your home for radon and take steps to lower high levels. Additionally, limit your exposure to workplace carcinogens, eat a healthy diet rich in fruits and vegetables, and consider lung cancer screening if you are at high risk. Avoid tobacco. Don't start smoking. Cigarette smoking is the leading cause of lung cancer. Quit smoking. Quitting smoking at any age lowers your risk of lung cancer and improves longevity. Avoid secondhand smoke. Stay away from the smoke from other people's cigarettes, cigars, or pipes. Test for and reduce radon. Test your home. Test your home for radon, a naturally occurring radioactive gas that is a significant cause of lung cancer. Reduce radon levels. If levels are high, take steps to reduce them. Limit exposure to other carcinogens. Be careful at work. Follow health and safety guidelines to avoid exposure to known cancer-causing agents like asbestos, arsenic, and diesel exhaust. Adopt a healthy lifestyle. Eat a healthy diet. Focus on a diet rich in fruits and vegetables, which may help reduce your cancer risk. Maintain a healthy weight. Being overweight or obese can increase your risk of cancer. Stay physically active. Regular physical activity is linked to better overall health and can lower cancer risk. Consider screening. Get screened if you are high risk. For high-risk individuals, low-dose computed tomography, LDCT screening, can detect lung cancer early when it's more treatable. The main cause of lung cancer is smoking, though other factors include exposure to secondhand smoke, radon, occupational hazards like asbestos, and air pollution. A family history of the disease and previous radiation therapy also increase risk. Lung cancer develops when damage to cells causes them to grow uncontrollably, forming tumors. Major risk factors. Tobacco smoking, the leading cause of lung cancer, responsible for most cases. Risk increases with the amount and duration of smoking. Secondhand smoke. Breathing in smoke from others exposes you to the same carcinogens as smokers, increasing your risk. Radon exposure. A natural radioactive gas that can build up in homes and buildings, making it the second leading cause of lung cancer in the U.S. Occupational and environmental factors. Workplace carcinogens. Exposure to substances like asbestos, arsenic, chromium, and nickel in occupational settings significantly increases risk. Air pollution. Living in areas with high levels of air pollution can slightly raise lung cancer risk. Other contributing factors. Family history. Having a parent, sibling, or child with lung cancer can increase your risk. Radiation therapy. Previous radiation treatment to the chest for conditions like Hodgkin lymphoma or breast cancer raises lung cancer risk. Genetic mutations. Acquired changes, somatic mutations in a cell's DNA, can remove the off switch for cell growth, leading to cancer. How lung cancer develops. Cancer begins when cells sustain damage, often from carcinogens in tobacco smoke or other environmental factors. This damage leads to mutations that cause cells to ignore signals to stop dividing or to die. Uncontrolled cell growth leads to the formation of a tumor, which can spread to other parts of the body. To prevent lung cancer, the most critical step is to avoid tobacco, including secondhand smoke, and to quit smoking if you are a smoker. You should also test your home for radon, a naturally occurring radioactive gas, and take action if levels are high. Other preventive measures include limiting exposure to workplace carcinogens like asbestos and diesel exhaust, maintaining a healthy diet rich in fruits and vegetables, and staying physically active. Lifestyle choices. Avoid tobacco. This is the single most effective way to lower your risk. Don't start smoking. Never begin using tobacco products, including cigarettes, pipes, or cigars. Quit smoking. If you smoke, quitting can significantly lower your risk of developing lung cancer, and your lung tissue can begin to repair itself. Avoid secondhand smoke. Stay away from others' tobacco smoke. Environmental factors. Test your home for radon. Get your home tested for radon, a colorless and odorless radioactive gas, and take steps to reduce levels if necessary. Minimize exposure to workplace carcinogens. Take precautions and follow safety guidelines to avoid inhaling substances like asbestos, arsenic, and certain chemicals at work. Diet and exercise. Eat a healthy, balanced diet. Consume a diet rich in fresh fruits and vegetables to provide your body with beneficial vitamins and nutrients. Stay physically active. Regular exercise can help suppress inflammation, boost immune function, and improve overall health, which can help resist cancer development. To prevent lung cancer, avoid tobacco products, including cigarette smoking and secondhand smoke, and minimize exposure to radon and other known carcinogens in your home and workplace. Regular checkups, including screening if you are at high risk, can help with early detection, and maintaining a healthy lifestyle by eating a diet rich in fruits and vegetables and getting vaccinated against respiratory illnesses can also help lower your risk. Lifestyle changes. Quit smoking and don't start. This is the single most effective way to prevent lung cancer. Your risk decreases significantly, even with quitting later in life. Avoid secondhand smoke. Create smoke-free environments in your home and car. Test for radon. Test your home for radon, a radioactive gas that can enter through cracks in the foundation and is the second leading cause of lung cancer. Protect yourself at work. Be aware of hazardous substances like asbestos, uranium, and other chemicals you may be exposed to at work, and follow safety guidelines. Eat a healthy diet. Consuming fruits and vegetables, rich in beta-cryptoxanthin, has been shown to help reduce lung cancer risk. Get vaccinated. Prevent chronic lung inflammation by getting vaccinated for diseases like the flu and COVID-19. Medical screenings. Get screened if high risk. For high-risk individuals, lung cancer screening with a low-dose CT, LDCT scan can help detect the disease in its early stages, improving treatment outcomes. Know the risks. Radon, a natural radioactive gas from soil breakdown that can accumulate indoors, especially in homes. Occupational exposures. Materials like asbestos, arsenic, and nickel can increase lung cancer risk. Air pollution. High levels of air pollution also contribute to lung cancer risk. It is important to know on how to prevent that cause of a lung cancer. Explain clearly to easy understand to our viewers about this health issues.